And if you'll put your arms on your chest or just by your side,
Okay.
And without using the chair, I want you to stand up and sit down. Your bottom has to touch the chair
Okay.
for each chair stand. And we're going to do this for.
It's something I can donate. I mean, I don't have money, but I can donate my information to help other people.
I want you to start at this tape. You're going to end at the fourth tape, piece of tape back over there.
Okay.
And I want you to start by walking at your normal speed. Okay? You can. Okay? Perfect. Okay, now this time I would like you to take the same pace, but at your fastest walking speed.
Okay.
Okay, go ahead. Okay, great. All right, now we're going to do it again. Again, it's your normal.
It may not necessarily be my blood that helps them, but it'll get them there.
There are only a couple of projects like this that where we're collecting the amount of people and the amount of data that we're collecting from each person. We collect samples for DNA, RNA, metabolomics, proteomics. Okay, so now we're gonna use the other leg, whichever
Okay.
leg you didn't. Okay. Any information that we can gain is going to impact decisions in the future about medicine.
Most diseases, most of the chronic things that afflict us, so high blood pressure, diabetes, arthritis, heart disease, those things develop over a period of many, many, many years. They don't, one day you wake up with it and the day before you didn't have it. So to be able to understand the transitions from being a healthy individual to having one of these illnesses, we have to follow people over time. We have to ask them questions. We have to monitor their physical exam, how they're feeling, what they're telling us about themselves, and hopefully, as we delve kind of deeper into specific diseases, even take their blood at multiple time points so that we can see what's happening that might be a trigger or give us a signal of what causes those diseases.
Good of a signature that we get.
So you think it's up here for the T cells?
Yeah, so probably more of the energy signatures. So you have glycolysis from T cells versus fatty acids.
Right. What we're trying to find is really MS. What are the causes and cures? Because that's why we're working on this studies to find a cure for this horrible disease.
If we were to find a blood signature of metabolites that is really specific for MS, that would be very helpful for clinicians in terms of diagnosis. And would also be very helpful in terms of prognosis. So are the drug treatments working? Are they being effective? Should we switch drug treatments before they have another attack, which could potentially cause permanent damage?
The extraordinary part about this is we have data that is unique, is the lifespan perspective. So I can go into the literature and look about aging, and I do all sorts of stuff, the same measures we're using, looking in 70 and 80 and 90-year-olds. But there aren't that many data sets that have these measures going to the 30, 40, 50-year-olds. So we can look across the lifespan and we can see what factors are most important and when in your lifespan. You know, when are these changes happening in people's lives that really influence how they age? We also know from the literature that it's never too late to change your behavior. So these are things, so by getting this lifespan, we can look at changes occurring in the oldest old, in the youngest, and how that influences life going forward and functioning going forward.
Not only are longitudinal studies long-lasting, meaning they track patients' health over a long period of time, they can also have long-lasting effects. In fact, many of the therapies that doctors and hospitals use today are based on the first longitudinal study. It was done back in Framingham, England, back in 1948, and it revolutionized our thinking on cardiovascular disease. Researchers with the Murdoch study hope their work has the same effect.
I think in terms of the breadth of what we're doing and the ability to look across all common diseases and to follow people from health through disease, and have this modern era molecular opportunity, the backdrop of all of the modern science that we can do, yeah, I hope people will 50 years from now say, wow, that Murdoch study, that really changed, you know, the course of how we treat people with common chronic diseases, that they made a difference. And you know, that's a lofty ambition, and it sounds a bit arrogant to say it, but gosh, that's what we're in the game for. We want to change human health and how we treat people.